Debbie actually sent a letter to the Dean of Students in the College of Public Health, and I think it was Dean Brzezinski, requesting the licensure agreement. And he agreed, and I think we paid $500. And Dr. Erwin had an opportunity to get us appointed a faculty person at the University of Buffalo in the law department. And she assisted us with myself and the National Board of Directors with completing a 501c3, 1023. We completed that application. And I think we got 501c3 2010, December 2010. And we had a developed board director from I think 5 regions across the country. And we were 501c3 at that point, and just trying to come up with, we had a mission already, but some goals and objectives and vision for the next 5 years and where we would be taking the program.
And it was the perfect opportunity with the separate not-for-profit of the Witness Project to partner with Roswell on our research programs and doing things, but at the same time for them to do their own things, and then they could write, and we helped, obviously the faculty at Roswell were helping write some of the grants and stuff, and they got Coleman funding for multiple years, and that was very helpful. And then, however, all of a sudden we didn't have any more funding.
Right. And at that point, I think that's when I took the initiative to be a little bit more enterprising and to diversify our portfolio, as we had been relying on those funding for a long time. I think Debbie and I and Patrick were visiting with Edmund at the hotel, and he was like, "Who's paying for this?" And I'm going like, who's gonna pay, right? And so I had done, I think, about 10 interviews with insurance companies all over the country, and some of the information was good, but what really stood out to me is when we talked to a young lady out of Florida with Aetna, and she said they had to hire private investigators to go find their Medicaid and Medicare members. So I share this information with Debbie, and running back to our visit with Edmund, Debbie says, Edmund says, who's paying the not-for-profit on the work that they're doing? And I go, the insurance company. And Debbie goes, the insurance company. And then we both looked at each other. We go, the insurance company. And from then on, we're like, who's paying? We did like 50 interviews. And
we found out they were paying other people to do things.
Right.
But they weren't very effective.
No,
and they weren't sustained.
Right.
And it wasn't like we could provide the outsourcing. We would be the outsourced company for reaching their members, convincing them to get screened, getting them there, navigating them, educating them, doing all the things that nobody else wants to do,
basically.
So that was really interesting. And for me, I think of it in terms of the research, in terms of, this is great because... And we have shown, it's shown that the increasing Medicaid and the Sentencing Affordable Care Act, more people are getting screened, more people are doing this. And part of it is because the primary care physicians and the health insurance companies are having to think in terms of, we got these people out, we have to make sure they utilize the services. So they're much more motivated. So that was really helpful to us in Sprint.